The Speech Pathology Australia clinical guideline for laryngectomy was critiqued using the Agree-To tool. The Agree-To tool assesses practice guidelines over 6 different domains: scope and purpose, stakeholder involvement, rigor of development, clarity of presentation, applicability, and editorial independence. When using the tool to assess scope and purpose, it was found that the guidelines state its overall intent and the reasons behind its development. The population to whom the guideline applies is specifically described as well as the health questions covered. Overall quality score was 66%. When assessing Domain 2 stakeholder involvement, we found that for each member of the guideline development group, their name, discipline, institution, and geographical location are listed, with their role in the group mentioned, however broadly. The experiences of individuals that have had a laryngectomy were overall poorly represented in the clinical guidelines for laryngectomy. However, members of Speech Pathology Australia lobbied for these guidelines to be developed due to the high clinical risk, invasive nature of the management, and the expansion of technology and evidence in the area. Overall quality score was 52%. After assessing Domain 3 rigor of development, it was found that the including and excluding criteria was not witnessed, and a description of the target population, study design, comparisons, and outcomes were not seen. The strengths and limitations of the body of evidence were not clearly described. Working Party, project officers, and Speech Pathology Australia were recognised in the acknowledgement section of the guidelines. However, no explicit reference to who externally reviewed the publication was made. However, there is an explicit link between the recommendations and the evidence that the recommendations were made in most cases, and the health benefits and side effects were considered. Quality score was 26%. Clarity of presentation returned a quality score of 86% after assessment using the Agree-To tool. The recommendations are specific and unambiguous. The different options for management of the condition or health issue are clearly presented, and the key recommendations are easily identifiable. After assessing the applicability of the guidelines using the Agree-To tool, a quality score of 21% was the return. The guidelines failed to consider the potential resource implications of applying the recommendations, and they do not present monitoring or auditing criteria. Assessment of editorial independence showed that competing interests of competing guideline development group members weren't recorded. However, the views of the funding body did not influence the content of the guideline. A quality score of 29% was achieved. Overall, after thorough assessment using the Agree-To tool, we would recommend it with some alterations. These would include for there to be recorded instances of competing interests between the development members and how they reach consensus to be described in greater detail. The guidelines' overall rigor of development must be greatly improved through a much more detailed description of how evidence was obtained and what was used to obtain it. The guideline must be externally reviewed, and this review should be explained. A procedure of the guideline to be updated should be introduced. A greater representation of the target population through including their experiences and preferences should also be considered. Thank you.